Fundal massage, also known as uterine massage. It is a technique used to encourage the uterus to contract properly after delivery of the placenta. It involves applying repetitive massaging or squeezing motions to the woman's abdomen in order to stimulate the uterus. Number 1. Assess the woman with factors that predispose to poor uterine tone or inability of her uterus to maintain a contracted state, such as conditions that increases a postpartum hemorrhages. Number 2. Obtain the mother's blood pressure and heart rate. Blood pressure drops abruptly due to vaginal bleeding. Number 3. Check for loss of blood that leads to hypovolemic shock, falling blood pressure, a rapid, weak or ready pulse, increased and shallow respiration, pale clammy skin, and increasingly anxiety. Lastly, estimate the amount of blood by counting number of perineal pads saturated in given length of time, such as a half-hour intervals. A rough estimate of the amount of blood loss can be formed. Number 1. Explain the necessity for the procedure and provide privacy. Number 2. Position the woman on her side when inspecting for blood loss to be certain a large amount of blood is not pooling undetected beneath her. Number 3. Palpate a woman's fundus at frequent intervals to be assured her uterus is remaining contracted. Good day, ma'am. I am Nurse Shaina and I will be your nurse for the day. I will render a fundal massage to control your vaginal bleeding and encourage uterine contraction. And I will close the curtain for your privacy. Help to decrease anxiety and providing privacy enhances self-esteem. Before we begin to the procedure, ma'am, I would to assist you to void or urinate to lessen the pressure and avoid discomfort. Ma'am, may I assist you to lie in the bed with your knees flexed? An empty bladder prevents displacement of the uterus and ensures accurate assessment of uterine tone. Proper positioning enhances visualization and effectiveness of procedure. Put on gloves. Ma'am, I'm going to start to massage your fundus by placing my one hand on your abdomen just above your symphysis pubis while my other hand is around the top of your fundus. This anchors the lower uterine segment and allows you to locate and assess the fundus. Ma'am, I am now rotating my upper hand to carefully massage your uterus in order to encourage uterine contraction. Massage should be done only when the uterus is not firm, and aggressive massage may lead to a partial or complete uterine prolapse. Ma'am, I can now feel that your uterus is firm. I will now press your fundus between my hand with slight downward pressure against my lower hand. Gently squeezing with downward pressure helps to expel blood or clots collected in the uterine cavity. Ma'am, please allow me to check your perineum in order to relieve the passage of clots and estimate the amount of your vaginal bleeding. This helps to assess the degree of bleeding.
Ma'am, we are almost done. I will do a fundal massage one more time just to make sure that your uterus is firm. Ma'am, I will now done with the procedure. I am now cleaning your perineum, and afterwards, I will apply a clean perineal pad.
This helps to promote comfort and hygiene while reducing the risk for infection.
After the procedure, I will document the result of the procedure, and I will continue to assess the fundus and lochia, and I will notify the primary care provider if the fundus does not remain firm or if the bleeding continues.
Documentation provides a means for evaluation. Continued assessment allows for early identification and prompt intervention with additional measures such as oxytocin to prevent hemorrhage.